Well, this morning we are following up with a new Missouri law that requires insurance companies to pay for diagnostic breast imaging. But this morning, health officials say there are still some roadblocks out there.
Our Mercedes McKay joins us in studio this morning. And Mercedes, what are the problems that patients are now facing?
Well, Rennie and Michelle, it all actually stems from a loophole in a law that's been in effect for over a year now. Insurance already covered basic screenings like mammograms, but most women actually need additional imaging. While the new law covers that, doctors tell us it's only to an extent, and further expansion is necessary to save lives.
This Missouri law was passed to try to help women prioritize their health. We want to put women first.
It's a law that many doctors, like SSM Health's Director of Breast Surgery, Pamela Bunting, were ecstatic to see make it past the Capitol Dome.
It was supported by the radiologists in Missouri. It was also supported by the breast surgeons. And quite frankly, I think it was supported by everyone that heard about it.
Starting in January 2024, health insurance companies were required to pay for diagnostic breast imaging for women, which is necessary for those who have a family history of breast cancer or have an abnormality in their mammogram.
We know that if we can find breast cancer when it's smaller at an earlier stage, the survival rates are increased. So we would rather find this cancer earlier rather than later so women have better outcomes.
The new law was supposed to wipe away those worries, but Dr. Bunting says it's not doing that for every patient.
The biggest thing that we have heard from the insurance companies after the patients have called them is that because the insurance company is not based in the state of Missouri, they go more by federal laws than they do state laws.
Which leaves women with out-of-pocket expenses they can't handle.
The biggest concern for women, quite frankly, is cost. Cost is very concerning.
Unfortunately, that's the loophole in the law. Missouri residents with insurance based in other states don't qualify.
I think it's going to take a federal level type law for us to be able to see the insurance companies fully and widely accept it. But in the meantime, we're still fighting for the patients because we do have a law here in Missouri that insurance companies need to pay for it.
Now, I did reach out to the bill's sponsor to see if she had any interest in sponsoring a new bill that would expand access, but I still haven't gotten a response. SSM Health wants to make sure women everywhere, regardless of your health insurance status, gets yearly screening mammograms. The hospital even has grants available to help women cover those costs.
Important, so important. Thank you so much, Mercedes. All right, everyone, get out the bug spray because mosquitoes are expected to be out